Thanks very much, Professor Toff, and I'd like to also thank Paul Swindell for inviting me here today to speak. I'm going to speak about putting defibrillators into community, but I'm also going to speak a little bit about the charity, just so that I can put it into some sort of context. So a lot of the conditions that SADS UK cover are for affect younger people as well as older people. And they're conditions of purely of the electrics of the heart rhythm, channelopathies. And this is a booklet that we put together with the British Heart Foundation. And we put it into plain English, which was quite difficult because it's such a complex area. But as you see there, it says heart disease doesn't just affect those in the later years of life. And we thought it was important the GPs knew that, because often it's the first person you go to is your GP. So this was sent out to all GPs a couple of years running, and our members quite often will take them into their doctor's surgeries now to explain a condition they may have. You all recognise this leaflet, the sudden cardiac arrest leaflet that Paul put together. Very important, as you all know, because a lot of you have benefited from seeing the booklet, taking it to your hospitals, and we have boxes of these in the charity. So if you've got any hospitals or any areas that you'd like us to send these to, just let us know. So we've got quite a few with us today, so please take some away with you today. Cardiac nurses are finding these very, very helpful. And as we heard earlier on today, the emotional side after a cardiac arrest isn't often appreciated enough. As Tom mentioned, yes, medically you get seen to and you're treated well, but then that's great. You've survived. You're lucky to be alive, and off you go out into community. We know that only too well, and how vulnerable people are left, and how the anxiety you heard from Marco earlier on. So we will help with formal counselling, and these are just some of the comments that we've had. And a little earlier on, actually, a gentleman came up to me and said that it had helped. I'd put him in contact with some other families with the same condition and the formal counselling, and I was really pleased to hear it had really helped him. Last year, some of you will remember this, we were involved in the Guinness World Record, another fantastic event put together with Paul at the Essex Cardiothoracic Centre. 127 cardiac arrest survivors, wasn't it, Paul? And they actually got the Guinness World Record, so that's absolutely amazing. And that's some of our staff there welcoming people to the centre. And this is the warning signs. We know obviously before a sudden cardiac arrest often there are no warning signs, excuse me, but where they're shown we want people to be aware of them. And with some of the conditions I spoke about that we cover, the channelopathies, the problems with the electrics of the heart rhythm, they can be genetic. So that's another sign that needs to be looked at, as well as the other signs you see on the screen there. So again, we're going back to children can suffer from cardiac arrest and from some of these conditions. You'll see there that 1 in 500 have got a cardiomyopathy, as well as some of the channelopathies that won't be apparent until somebody has a cardiac arrest. And of course there's accidents, respiratory arrest, choking, any sort of trauma. So one of the things we wanted to do was to get defibrillators into all schools. As the hub of the community, we felt they really should be in place there. You've got parents going, grandparents, often used for after-school activities. So we wanted to see defibrillators, and we still want to see them compulsory in all schools. We put together a petition, and that's me handing the petition in with the West Midland Ambulance Service, London Ambulance Service, and an MP from Redditch. It was very well supported. And it actually got highlighted quite a lot in the media. But and after that I had a meeting with the Department for Education. And they said that defibrillators should be considered as part of the first aid equipment. So that was a major step forward. But we really do believe they should actually be mandatory in all schools. But it's good to know that they recognise the defibrillator and have told schools about the benefits of putting one in place and letting the ambulance service know where it is. So we've set up our SADS UK manifesto, and this sets out about getting the defibrillators into schools more widely in the community, about the support we need for cardiac arrest survivors, for people who've been bereaved through sudden cardiac death, the research that we need carried out. There's a lot in that document, and we've got them here if anybody would like to take one. But I think one of the most important things is for people to tell their stories. So if we can get people signing these, telling their stories, and then next year I'm going to take a dossier to 10 Downing Street just to keep this issue highlighted. Another thing that's become apparent to us is we're getting a lot of defibrillators out in the community now, and you'll all have seen them out in the cabinets, but not everybody knows that in an emergency anyone can use them. So we think there should be a government-funded initiative to show people what a CPAD, a community public access defibrillator, looks like and how it actually works to access the defibrillator and to use it. As I say, at the moment, obviously people in the know are very aware that they can be used, but not everybody understands it. And if maybe the BHF could stand up, come up to the mark. They managed to do the Vinnie Jones advert, didn't they, which was very, very compelling. So if they did something similar, that would be brilliant. And this is a walk we're going to do next year in Hyde Park around the Serpentine. And it's sort of raising awareness and funds for all the things that are in the manifesto. And if anybody would like to join us, we've got a list up on our stand there if you wanted to put your email address down. And we've already got quite a few people signed up for that. So I spoke about research, and this is some research we do at the University Hospital Bristol, looking into the short QT syndrome. And with a lot of the research that they're doing, it actually helps with other arrhythmias, it overlaps. So we're really pleased to be supporting that. And you heard from Marco earlier on this morning about the amazing work he's doing with the care facility. And Tom as well spoke about the care after resuscitation project that they're really piloting, if you like, in Essex Cardiothoracic Centre. And it would be great if they, if this can be a model that can get out for other areas of the country, it would be a really gold standard for them to follow. And this is Dr. Andrew Grace, one of our patrons, looking into the sudden, the mechanisms into sudden cardiac arrest. So again, we think research underpins all what we're looking at here, and he'll be speaking a bit later on today, and is very well versed in implanting ICDs and electrophysiology. So any questions you've got, I'm sure he'll be able to answer. And this is our Lifesaver Awards. When we first started putting defibrillators in schools, everybody thought we were mad. They said children don't have cardiac arrest. As you see in those pictures there, there's two youngsters in those pictures saved by staff at their school. Absolutely amazing. And that was using the school defibrillator. So that's just two. And every year for the last 7 or 8 years, we've had youngsters being saved by their teachers at school. You might recognise some of the people here from Sudden Cardiac Arrest UK. They support our Lifesaver Awards, which is brilliant. Chris Solomons, who many of you may know at the front there, the chap in the white shirt, and Charlie, young boy there that was resuscitated. So again, we're talking about young people. And in fact, a lot of the people there have had a cardiac arrest. So we're talking of people of all ages. This is our public access defibrillator officer up in North Wales. He goes around just checking that all the defibrillators are functioning correctly. They've all got their pads and their batteries. He also carries out training in the schools and in the wider community. The out-of-hospital cardiac arrest in Wales is even lower than in England, so we felt it was really important to have somebody up there trying to assist with getting the out-of-hospital cardiac arrest rates up a bit. Again, not all the cabinets will go on an outside wall. Sometimes you've got a glass-fronted building. So my husband, who's a design engineer, has designed these various stands. As you see, one of them outside a bus shelter, another one in a shopping centre. So, you know, they can be installed practically anywhere. In phone boxes is another popular place, and you may have seen them in phone boxes. A good use of keeping it nice and warm and safe inside that. You'll see there some cabinets. You'll see in the middle a green one, which is quite conspicuous. This is for places of natural beauty where they don't want to put a yellow cabinet in place, which is a bit of a shame because obviously the reason for it being there is so that it stands out and people will use it. But we think it's better to give them the colour they want rather than nothing at all. Wi-Fi technology, there's several defibrillators now that are Wi-Fi connected, and instead of having to go and manually check the pads and the battery, it will alert to your computer, so that's good in very big organisations. So everything's moving forward quite a lot at the moment. And these are just some of the organisations we put the defibrillators in and the training. And it's always good to see actually how people find the automated defibrillator so easy to use. As I say, years ago people thought, oh, only a medical professional could use it, but now it's absolutely anyone. And there's projects in the community, and this is the Do It for Defib project, and Charlotte will be telling you a bit more about this later on. Quite an inspirational and amazing story. And people like Charlotte setting up projects in the community to raise awareness for cabinets and put them outside and help to save lives. You might have seen this on the news, the Alexa picking up people sort of not breathing right, or hopefully eventually they'll pick up agonal breathing, but this is just a prototype at the moment. But it just shows you how well things are moving forward with technology, doesn't it? Absolutely amazing. So hopefully that will be something that will come in the future. So these are details, and as I mentioned, we've got all our leaflets at the top there. And I'd like to now pass over to Charlotte, who's going to speak about her project, Do It for Defibs.